Hi there, welcome to the MedPro Education channel. Our today's topic of discussion is ECG, how to read ECG, mastering the ECG interpretation. In this topic we will cover following topics. What is ECG and its types? What are the components of ECG? What are the ECG Leads? Systematic ECG interpretation. Practical tips for interpretation. Electrocardiogram or ECG. Electro mean electrical activity. Cardio mean heart. Gram mean graph. ECG is a graphical representation of the electrical activity of the heart. It records the timing and strength of these impulses as they move through the heart, producing a waveform that can be analyzed to assess heart health. Following is the types of ECG. Resting ECG, performed while the patient is at rest. It provides a snapshot of the heart's electrical activity. Stress ECG, conducted while the patient exercises on a treadmill or stationary bike to evaluate how the heart performs under stress. Holter monitor, a portable ECG device worn for 24 to 48 hours to capture the heart's electrical activity over an extended period. Event monitor, similar to a Holter monitor but used for a longer period, up to a month, and activated by the patient during symptoms. What are the components of ECG? First we will try to understand ECG paper. On ECG paper we measure voltage on y-axis and time on x-axis. The ECG paper is divided into a grid of small and large boxes. Each small box is 1 mm by 1 mm square. It represents 0.04 seconds, 40 milliseconds, of time and 0.1 millivolts, MV, of voltage. Each large box is made up of 5 small boxes, creating a 5 mm by 5 mm square which represents 0.2 seconds, 200 milliseconds, of time and 0.5 MV of voltage. Now move on to ECG waves. P wave which represents atrial depolarization. QRS complex which represents ventricular depolarization. T wave which represents ventricular repolarization. PR interval is the time between atrial and ventricular depolarization. QT interval is the time from the start of the QRS complex to the end of the T wave. Understanding ECG leads, a quick guide. In electrocardiography, ECG leads refer to the specific configurations of electrodes placed on the body to record the heart's electrical activity from different angles. There are 12 standard ECG leads, divided into 2 main categories, limb leads and chest leads. Limb leads are placed on the arms and legs. These include leads I, II, and III, which create a triangle around the heart, and the augmented limb leads, AVR, AVL, and AVF. Chest leads are placed on the chest, around the heart. They are labeled V1 through V6 and provide a view of the heart's electrical activity from different horizontal planes. To get a clear reading, the electrodes need to be placed accurately. For the limb leads, electrodes are attached to the right arm, right leg, and left leg. For the chest leads, electrodes are placed on specific locations on the chest. Systematic ECG interpretation. We're diving into a systematic approach using the rate mnemonic to help you identify deformities and structural issues on an ECG. Assess rate. Calculate the heart rate by counting the number of QRS complexes in a 6-second interval and multiplying by 10. Or know of large boxes between 2 QRS complexes and divide it by 300. Now tell me, is it bradycardia or tachycardia? Assess rhythm checking R2R interval. Is it regular, or regularly irregular, or irregularly irregular? Axis of heart. In normal ECG an upright positive QRS in leads I and AVF, 0 to plus 90 degrees. Deviation of axis to right in RT ventricular hypertrophy, a downward QRS in lead I and an upright QRS in lead AVF. deviation of axis to left in LT ventricular hypertrophy, an upright QRS in lead I, and a downward QRS in lead AVF. Note, if you hold ECG in your hand, lead 1 is on your left hand side and lead AVF on your right hand side. If both leads show positive QRS, there is no axis deviation. If any of two show negative QRS, there is axis deviation and it's on positive QRS side. Hypertrophy of chambers. P wave is M-shaped in left or mitral side atrial enlargement. Peaked P waves show right or pulmonary side atrial enlargement. Right axis deviation in right ventricular hypertrophy and left axis deviation in left ventricular hypertrophy. Analyze infarction and ischemia by looking for ST segment elevation in ME and depression in ischemia. Don't forget to check the reciprocal leads changes. In interventricular septum ME or ischemia, there is ST changes in V1 V2. In anterior wall ME or ischemia, there is ST changes in V3 V4. In lateral wall ME or ischemia, there is ST changes in V5, V6, I, AVL. In inferior wall ME or ischemia, there is ST changes in AVF, 2, 3. In pericarditis there is diffuse ST elevation, across multiple leads without reciprocal changes. Look for intervals. PR interval, it's the time interval from the end of atrial depolarization to the start of ventricular depolarization, should be between 120 to 200 milliseconds. Prolonged PR intervals can indicate atrioventricular, AV, block. Prolonged PR interval in heart block type 1. Progressive prolonged PR interval and skipping of QRS complex in heart block type 2 Mabitz type 1. Skipping of QRS complex but PR interval is same than it is heart block type 2 Mabitz type 2. If P waves bear no relation to the QRS complexes is heart block type 3. QRS complex, assess the duration, should be 120 milliseconds. A widened QRS complex can indicate bundle branch block or ventricular hypertrophy. Broad QRS complex, 120 milliseconds, with a characteristic W and M shape in leads V1 or V6 indicates left bundle branch block. Broad QRS complex with a rabbit ear appearance in lead V1 indicates right bundle branch block. QT interval is the time between ventricular depolarization and repolarization. Is prolonged due to drugs such as clarithromycin, citalopram, voriconazole or due to congenital condition like long QT syndrome, shortened hyperparathyroidism high Mg and Ca+. T-wave, observe the shape and direction. Abnormalities can suggest issues such as ischemia or electrolyte imbalances. Tall T-wave in hyperkalemia. Flattened T-wave or inverted T-wave or U-wave after T-wave in hypokalemia. Mastering ECG isn't just about reading rhythms, it's about saving lives. Keep honing your skills with passion, stay curious, and remember, every beat you interpret brings you closer to making a real difference. Keep up the amazing work. Thanks for watching MedPro Education channel. Don't forget to like and subscribe for more content like that.